My name is Sara Stockton, and I'm a licensed marriage and family therapist. Since beginning my training at Syracuse University in 2008, with an emphasis on sex and gender issues, I've spent over a decade developing standards for assessing youth with gender dysphoria, but today I'm here as a whistleblower. I've seen children and teens rush into irreversible medical decisions, sometimes after a single session, with no chance to learn other ways to manage distress. I've watched families left heartbroken. At Syracuse, I helped develop a comprehensive assessment for gender questioning youth, emphasizing thorough evaluations to give time to explore identity before medicalization. By 2015, gender clinics started popping up, and organizations like Planned Parenthood began prescribing hormones without these thorough evaluations. Families were told puberty blockers were fully reversible despite emerging evidence of risks. Vulnerable teens, including those on the autism spectrum or in foster care, were funneled into medicalization for what were often social difficulties or trauma, not necessarily gender dysphoria. In one case, a former patient of mine who's gay reported that he was harmed by another therapist who rushed him into medical transition. He was so upset with nowhere to turn to for help. I had never heard of the term detransitioner, and I had never encountered someone who was this distraught and harmed by what has happened. His providers would not provide any guidance, no recommendations, but to continue his transgender identity. We had been assured that regret was rare if it existed at all, and that affirmation was the only path. Almost every professional I encountered validated that I wasn't just treating children, but saving them. In reality, the system was failing them by prioritizing affirmation over developmentally informed therapy. When I raised concerns about a friend group of 4 teens transitioning all together in 1 month, I was silenced, and I was told I had no basis to question that. Inspired by public discussions, I spoke out in the documentary, What is a Woman? The backlash was swift. I was terminated from the university and blacklisted from organizations after I was there 15 years without any formal complaints against me, and every single evaluation was about my exemplary service. But I am here because the truth matters. The promise of saving children would mean that I would risk their fertility and their sexual function, bypassing all the safeguards we apply in every other area of therapy. When we talk about modality, my biggest fear is that the largest cohort that will end up taking their life are the detransitioners, because they do not have a way out. Our children and their families deserve care, time, and honesty, not promises the medical system cannot keep. Thank you.